Hey D2s, I'm going to walk you through prepping our 14X, which is a number 5 DO, and our number 30 buckle class 5. The number on the root surface will be 46 AC. We're going to restore the number 5 with a core buildup material, which we haven't used before, just to give you the opportunity to try a syringe, a core buildup material, and then we'll restore our buckle class 5 with a glass ionomer. This is what the buckle surface of your number 30 will look like. And you can take a minute to kind of see where the decay is, try to visualize how far it goes incisally or occlusally and gingivally and then mesial and distally. And, remember that for buccal class 5s, we don't have the same kind of criteria that we have for a class 2 or a class 3. So in general, your goal here is to get into the dentin. So carefully work your way through the enamel and try not to fall into the dentin. That can happen sometimes with these burrs. So you want to be really careful like that. But you do want to break through to where you can see that dark decay. And you also want to extend these mesially and distally to try to include the breadth of the decay that we have on this tooth. This is a pretty basic width of a 330 line that's kind of been opened up into the lesion. And so you can see that going into the depth of the dentin, it really is going to take away a lot of the decay. I haven't really widened it a whole lot, and I really haven't gone as far to the mesial as I can to try to get onto sound tooth structure. So you want to try to do that. The distal's looking good, but at this point, I would want to extend a little bit further to the mesial to try to find a nice clean mesial wall in this preparation. So I didn't really show you, but there was a little bit of decay up on the occlusal wall and a little bit down on the gingival wall. And you can see that this prep has been extended again more to the mesial. You can think of this in terms of modifications. I don't think we really need to walk through true modifications for a class 5 because we don't really have criteria to do that. But you can think about it that way, and doing it in a stepwise fashion is always a good mindset. So here you can see I finally got to the point where my mesial wall is starting to look clean, but there's just a little hair of decay in that kind of DEJ region across the occlusal and maybe a little bit onto the mesial. take a look at this number 5 DO. Here you can see just a punch cut into the marginal ridge there on the distal, just to kind of show you where the decay is and get a nice stopping place for your burr so that you can start to kind of work facially and lingually to develop a box there. This prep that I'm showing you was done as a slot prep, and that would be a perfectly reasonable thing to do, a very conservative thing to do if there's no decay on the occlusal surface. In the end, when it comes to taking any kind of exam on a typodont, you want to prep a conventional prep, and that's what I want you to do today, just to practice doing that. I know this is going to be indirect vision, and it's the first one that y'all done on the mannequin and the posterior for class 2. So if you want to drop a box first, that's great. That's actually how I typically do my class 2s on patients is I drop a box, and then if I notice I need to do anything on the occlusal, I'll add it. But I want you to add it today, and I want you to keep that in mind because the boards especially can be sneaky, and they can put some decay in that occlusal area that you can't see. So you just have to, like, there's just not a question about it. You're going to have to do a conventional class 2 prep when you take your boards. Here's just a few more steps working on that DO kind of slot prep. You can see that it was widened a little bit to try to open things up. You can see the extent of the caries on the axial wall, like into the depth of the axial wall is pretty extensive. This caries is placed a little bit more on the facial than on the lingual. So I think you'll feel like you'll be widening that area a little bit more, but you got to break contact, right? For all of these contacts. And when we're thinking in terms of boards to max this out, you're going to want to break all those contacts up to 1 millimeter. This is a pretty reasonable ideal prep. You can see everything is just barely broken and we have a reasonable depth. This might be just a hair wide for a true ideal. You can probably go this far for maxed out, but this is a good place to practice your hand skills to keep this at ideal. And then you can work on maxing it out, which is going to involve, from this picture, lowering the gingival floor, right? You can lower that floor until the space between number 4 and number 5 is 1 millimeter. And so I would try to be able to stick a 1 millimeter diameter burr down in there, or maybe my hatchet with that 1 millimeter width, something that I can fit in that space to confirm that it's a millimeter. So drop the floor all the way till you get there. You're going to open up that facial contact all the way till you break it by a millimeter. And then you want to max out your axial wall. From this perspective, there doesn't appear to be any decay on the lingual box wall. So you don't need to change it. You don't need to max that out. You don't have to open that contact up to 1 millimeter. You can leave it exactly where it is. And so there is a way to stay kind of conservative when it comes to 8X rules. But in the end, the idea is going to be that you're going to extend all of these external walls until there's no decay on them. So if you want to think about it patient-wise, that's what we're going to be doing, is work with the external walls first. And even though this is a slot prep, I would save the axial wall until later. It is kind of an external wall for a slot prep, but it's going in towards the pulp. And so we're going to treat it a little bit differently. We don't want to create caves necessarily, but if you start to have to take that in quite a ways, I would open it up as conventional, and we're doing that anyway. So even though there's not going to be a lot of decay on, say, your pulpal floor when you open up this isthmus, it's going to allow you to see the decay on the axial wall better and have an idea of how you're going to approach it. Here you can see how Dr. Miller took a round burr and started to work on the axial wall. And in real life, that's what you would do. You don't want to leave any kind of caves with some undermined enamel that would risk fracturing. But for the most part, if you can conservatively remove the decay with a large round burr at a slow speed, it's the best way to have a conservative approach to the pulp. You just don't want to take away all that protective dentin if there's not any caries on it. You want to use that as a nice thermal barrier to protect the pulp anytime that you can. And so if you can be more selective in removing your decay with a spoon excavator or a large round burr in your slow speed, and take it down to 25,000 or 30. And I tend to use it without water just so that I can see the little flakes coming out and see kind of what their texture is. It's a good clue as to how much decay is actually left. You can have a nice conservative approach to removing decay that doesn't involve creating these giant boxes. That's just unnecessary. So again, here's the final slot prep. Ours is going to be conventional. I think that's just going to give you more convenience form too, to really be able to see what's going on the axial wall. It's going to give you some good retention form as well. if you were doing an amalgam with this, for example, having that isthmus and dovetail is going to help this be a little bit better retained. If you were to do a slot prep with amalgam, right, you've got to have retention grooves, or you could have a little dovetail onto the occlusal surface. So you got to have something based on the material that you're going to use. And so again, it's just a good idea to prep a nice isthmus with a pulpal floor and a dovetail whenever you do a class 2 on these typodonts. Just a little bit of a view from the facial so you can see how open things got. I think it's also really nice that you can see how nicely smooth that facial margin is and how convergent that wall is. So again, this is just my soapbox about prepping conventional class 2s so that hopefully you don't forget. You can always add an isthmus and a dovetail in class if you work mostly with a slot prep. But it's really important when you take boards. I asked Dr. Lillard, is it acceptable to prep a slot prep for class 2 on boards? And he 100% advised against it just because, and it happened the first time that our D4s took boards, the very first time we had anyone attempt it. And they had, not every tooth is the same, right? And some people had a little bit of decay up on the occlusal surface, actually across the oblique ridge because it was maxillary molar. It was super sneaky, and they failed because they didn't even open it up and didn't even know it was there. So prepping the entire occlusal surface for your boards in a reasonable manner is the safest thing to do. Okay, so I picked this tooth just as an opportunity to try out this material. It's really not big enough to count as a buildup. There are other situations, in this tooth in particular, it had some pretty deep decay that a student took out, and I just had this tooth that they donated, and it was perfect to do a little bit of a core buildup. But it was an MOD, and it got kind of wide, and it might be a good situation, especially with the loss of tooth structure on the lingual, that you might consider doing a crown. And so I went ahead and set this up with a Tafelmeyer band. You can see that the band is placed so that I've got some height on my marginal ridge areas so I can build it up. I did have to place a couple of wedges in the distal. These caries teeth are actually slightly bigger occlusally. The way they come up out of the tooth, it's weird, and there was a huge gap between the number 18 and the number 19. So I had to put 2 wedges in there, and that's okay if you need to do that to close things up. You just don't want it to open your contact. So be careful with that. So I got my Tafelmeyer all set. We're using a syringeable core buildup material called Build It FR. The FR stands for fiber reinforced. And this is available in the clinic, but I really don't think a lot of people are using it. I tend to get, what'll happen is they'll buy some, it will expire, and then I ask for it so that we can use it in clinic because they can't use it, or in lab because they can't use it in clinic. So you may not have the opportunity to use this in clinic, but we think it's really important that you try it because you're going to use it in private practice. You're probably not going to take, it takes a lot of time to do 2 millimeter increments of composite with a really giant buildup. And so to understand how to do this syringeable material is really important. So you can see it comes in this separate syringe and tip. And you'll have to either take off the existing dried up tip or take off that little cover. And we're going to put a new tip on. Before you do that, you want to bleed it. And so you can get a mixing pad or a paper towel or something. And you just want to squeeze a little bit out of the 2 holes that are on the end just to make sure there's not anything dried up. These have been sitting around for a little while, so it's always a good thing to do that. And then you're going to put the tip on. And if you notice on the tip, like a lot of things in dentistry, there's this little triangle notch that's going to fit into another triangle. And it's kind of hard to see in this picture, but I have an arrow pointing to that little triangular notch where those are going to line up. These are the 2 little areas that you just bled. So you can see that's going to come out. This particular color of buildup material is gold. That can be a really helpful thing if you are going to have a subgingival margin, especially that's hard to see, and you've got to get your crown margin past the material margin. That's something we'll learn about later in fixed. But for now, we're just going to practice putting in this material. So once you get your tip on, you're going to place the material into the preparation. And the best advice is to place the tip in the deepest part and start filling and cover the entire floor, and just don't lift the tip until you kind of have it buried in the material. And then as you continue to place the material and it extrudes from the tip, you can gently lift, but you don't ever want to come up out of it and then place the tip back in because that can introduce air pockets and bubbles. So it's just a slow process. To be honest, I feel like these tips and these syringes are kind of difficult to get the material out at this point. It just may be age. these have not been refrigerated. They're supposed to be. So that might be part of it too. We do have some that's refrigerated. I think you get to use those and fix, but I just want to use this material up, and it's still a good experience. So if you need to do these benchtop, that does not bother me because I think it's going to be challenging with how difficult it can be to get this material to come out to do it in the mannequin head. But here's my material placed in the tooth. I had to come back and add a little bit more because I felt like there was a little gap, especially on my mesial lingual box margin. So I came back in and added a bit more. And if you feel like you need to move it around, I think a good way to do that is with the micro brush that you use to place your bond. And we didn't talk about that. I'm going to have some Allbond 3 sitting out just because you need that generation of bonding to use with a buildup material. If you use OptiBond Solo Plus, it will fail. It won't bond and it will come out. And so in the clinic, you'll use OptiBond FL, which is the correct generation to use with a core buildup material. Allbond 3 is also good. So I'll have those sitting out on the bench tops at the sinks. If you want to take your Typodon up there to do the buildup procedure, you can place a little bit of the Allbond 3. You'll have an A and a B primer, and you'll mix a drop of each of those in a well. And I'll have some wells out there, and then you'll place the primer and cure, a little air dry and cure. And then you will have a drop of the adhesive, and you'll place that in air dry and cure. And then you can place the buildup material. The buildup material for Buildup FR, when you have a colored material like this, it just has to set up. It's not dual cure. It's going to auto cure in about 4 minutes. So you'll have about a minute and a half of working time, and then you'll have to kind of just let it sit for another 2.5 minutes. And then at that point, you can take it off. And so the way I typically do it is I'll take my wedges out, and then I will undo that end screw on my Toffelmeyer band. That'll loosen it up enough just so that the whole thing can come off. As you can see in that picture up there, all that's left in there is the band. And then I can get my cod pliers and pull that out. And so the last picture I have here is my buildup for this MOD. I haven't cleaned it up. Now you're going to take some burrs to it. And in reality, if you had time with your patient, you would just prep the crown and make a temporary for them. So that's something that you'll have to build up to and have enough time in your schedule when you're either a student or in private practice so that you can do a build up and a crown in the same appointment.